ever watched that James Bond movie, The World Is Not Enough? Well, vaccines are not enough. This article says vaccine alone will not stop COVID surge. I mean, and we all knew that it was not enough, but we knew it was never going to be enough. But it's still to see it um to see it stated in this way is still a little funny. The director of the Pan American Health Organization, PAHO, Dr. Carissa F. Etienne Wednesday urged countries to employ a comprehensive strategy for not only immunization but also public health measures to curb the surging coronavirus pandemic. So not only vaccination, but other public health measures. Yes, we need more comprehensive strategy towards everything. Just more authoritarianism, more surveillance, more control. That's what she's saying. Just more everything. Just 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 tighten the chains a little tighter. Just a little tighter. She warned that COVID-19 vaccine deliveries to the Americas have slowed. Reports indicate that countries report more than 1.3 million new cases in the Americas, while nearly 36,000 deaths died from the disease in 1 week. I cannot stress this enough. For most countries, vaccines are not going to stop the wave of the pandemic. Wait. But vaccines are not going to stop the wave of the pandemic. But wasn't that the narrative for the whole of 2020? Like, we gotta get the vaccines. We gotta. Wasn't that the reason you rushed the whole Operation Warp Speed and rushed all these experimental vaccines? Wasn't the vaccines the cure to end the pandemic? And now we're being told later on down the line that it's not gonna be enough. I mean, we know that. You watching this video knows that because they say in their own literature that the vaccines don't stop the spread or the infection and can only lessen the symptoms, which I do not believe in that lessen the symptoms, because they even cause people who got vaccine to get the virus and then they die. So I obviously vaccines are not gonna help, but they're not even following their own reasoning. Dr. Etienne said during her weekly media briefing, adding, there are simply not enough of them available to protect everyone in the countries at greatest risk. Therefore, we need to stop transmission by any means possible with the tools we have at hand. This will require comprehensive strategies to both accelerate the rollout of the vaccines and control the virus using proven public health measures. Oh ho ho! The public health measures are proven, are they? No research to back up your claims and claim to follow the science. Not a lick of proof. None. No data. Nothing. All the data proves the opposite. That lockdowns don't help and they cause more destruction. That the masks don't help. They're not just useless. They're not just there to dehumanize you and deperson you and to hurt you psychologically. They're also dangerous for your health, causing bacterial pneumonia, hyperoxemia, hypercapnia, gum disease, candida, a whole host of things. Blur the oxygen that goes to your brain, which can severely hamper the development of children. So they're not just useless, they're even more dangerous than they are useless. Social distancing is just to keep you away from human contact, which you absolutely need. People need human contact. Right. And hand hygiene. All these soaps, all these hand sanitizers and soaps that they're making right now are very, very harmful to your health, to your skin, to your bodies. The hand sanitizer, especially with all these dangerous chemicals. I mean, if you really stand back and look at it, these so-called proven public health measures are way, way more dangerous than the COVID-19 virus. Way, way more dangerous. It's like it's all a plan. You should never trust any of these government agencies, these people, World Health Organization, PAHO, all these organizations. Never trust a word they say. They have funders. Most of them are funded by Bill Gates. Known eugenicist, known psychopath and all around crazy person, George Soros, globalist, eugenicist, These are people that actually want to kill people. I mean, when you have that kind of wealth, people, I don't know, this is only a theory, but when you have that kind of wealth, it's like, what can you do now? I mean, you have all the money in the world, you can only do so much. And it's like, they've done everything and they look to control and power. Because money doesn't necessarily mean power and control. Money just means you're rich. And sometimes that is not enough, especially for narcissists and psychopaths. Because they believe that just because they have money that people should respect them and do whatever they say and follow their orders to the T and worship them like gods and all this sort of stuff. And they believe that, which is false. And when they realize that, oh, just because I have money, people still aren't respecting me and treating me like I'm God, and they kind of break, and then they look to gain power. See, they use that money, that no acquired money, to gain power, gain control. These are very broken people. Money doesn't matter to these people. Doesn't matter. Power. They're very insecure and self-centered, so they need the power to make them feel strong. They like to dominate, feel strong. Because when you take away all that money and all those assets and you remove all that, they're just people. And they can't fathom that, they can't understand that. So that's why they want that power now, to make them feel like gods. And we gotta show them that they're gods. They're just men. Where was I? PAHO said that since March, its revolving fund has helped deliver more than 3 million doses of COVID-produced vaccines to 28 countries. Thank you, my overlords, for providing poisons to 28 countries. Thank you very much. The revolving fund negotiates purchases and arranges logistics for shipping of vaccines to 38 countries that participate in COVAX. So far, in the Americas, including the Caribbean, more than 247 million COVID vaccines have been administered, including through deals countries made inevitably and vaccine producers. I don't understand, man. Don't these people know that these things are dangerous? I mean, how can you sleep at night knowing that you sold and participated in the genocide of millions? I mean, you would have to be fuck. You would have to be solid stone, or the money just keeps you warm at night. I mean, that's a probably getting a lot of money for doing all this stuff, but I mean, there gotta be at some point. Or it's just money. It's just okay, and then you got that gnawing feeling at the back of your head, like this is a bad thing. This is bad what I'm doing. This thing is gonna kill millions of people. I mean, I guess people that are already in these positions were people who are more predisposed to being psychopaths and narcissists. These people that are at top of these funds and these organizations, and they've already been thoroughly vetted, background checked, looked into. Their personalities are known. They're groomed and molded for these positions. So I guess there are probably some outliers, but most of these people are already made for these jobs. So, yeah. But in the past few weeks, Dr. Etienne said constraints on producers of COVAX vaccines have slowed deliveries, and supplies are not expected to normalize for a few weeks more. In the meantime, we cannot rely on vaccines to control transmission, she said, adding PAHO is committed to working with member states to secure more vaccine doses for our region as soon as they are available to complement what countries have already purchased via bilateral deals and through the COVAX facility. We will be here for countries at every step of the way, providing technical support to troubleshoot roadblocks, increase surveillance, and monitor the safety and impact of COVID vaccines. Yep. Dr. Etienne cautioned that the pandemic continues to surge across the Americas. In the past week, more than 1.3 million people were infected with the virus, and nearly 36,000 people died from the disease. I'm sure 36,000 people died, but I'm not sure if it was from COVID-19. Could be from the vaccine and tested positive. Could be ventilators. Could be chronic illnesses and they died positive. Could be deaths that are not related to the virus in the slightest. I tell you, as I said in my video on the PCR test, the PCR test is the foundation for all of this. PCR test equals cases. Cases equals COVID-19 illusion. They changed the definition for all of these things. Like, pandemic is based on deaths. A pandemic is not based in cases. You can test as much people as you want and get as much positives as you want with the PCR test. Upwards of 97% false positives. You can get as much positive cases as you want. And that's going to continue to fuel the agenda more vaccines, which means more adverse reactions and more deaths, which then they're gonna categorize as COVID-19, and it's gonna be a cycle just continuing as long as we let them. They're gonna they're gonna they're gonna get away with what we let them, as long as it takes. We gotta stop this as soon as possible. We can't let them get to the stage where it's no longer where we're no longer able to fight back. Because right now we could protest, we could say we ain't taking it. No, there's a whole host of ways to fight back at this moment. But what about a year from now, 2 years from now, 5 years from now, 10 years from now? What is that gonna look like when they have their COVID passports and have the? You think is the police are bad right now? You don't want to see martial law where they're gonna be coming into your homes and force testing, and once you test positive, they drag you off to a isolation facility. And then tell you, then put you on a ventilator when you don't need it. They can kill you. They're gonna get paid. I mean, it's bad right now, but it can get worse. It can get way worse, and we don't want to see that. I think it's gonna be worse than what's written in books like The Brave New World and 1984. And I think it's gonna be worse than that because the technology is gonna be more advanced. They're no longer gonna be looking at you from through your camera or listening to you from through your microphone. They're gonna be microchips inside your body, and they're gonna be know what you're thinking. And if they know what you're thinking, they're gonna know what you're gonna do. If they can, we get to that point, it's done. Done. It's over.